Yes. So, hello everyone, and again today I have a very important person, another DBMCI star with us, Dr. Pranjal, who has achieved an amazing rank of 21 in the recent INICET examination. So, first of all, heartiest congratulations, Pranjal.
Thank you, ma'am.
So, how are you
Uh,
feeling?
Yeah, ma'am. I am feeling quite happy about it.
So, did you expected a double-digit rank, Pranjal?
No, ma'am, not exactly. I expected about like this rank. I didn't expect, but it still came to that.
Okay, so I think then you must be even happier. You have got such a good rank and you were not expecting it. So it's a very pleasant surprise then.
Yes, ma'am. It's a good surprise to me.
Yes. So, Pranjal, introduce yourself. You were our Delhi Foundation batch student.
Yes, ma'am. I was a Delhi Foundation batch student. I joined Bhatia during my third year, and
Okay.
so I have continued with Bhatia in my third year, final year, and in my internship.
Okay. So you have done your most important work of the notes preparation with the DBMCI.
Yes, ma'am. The online live lectures, most of them I have seen.
Okay. So you were from the COVID batch, I suppose. You have.
Yes, ma'am.
Yes, so we were shifted to the online platform,
Yes, ma'am.
and I still remember that I think that batch was having ophthalmology as
Yes,
the
ma'am.
first subject, and I still remember I was not having all the arsenals that are actually important for taking the online class, and it was so abrupt, but we had to continue the classes. We had to give you the best at that time, whatever was possible. Right. So, Pranjal, you completed all your subjects on the online app. How was your experience of all the subjects, fundamentals, concepts?
Ma'am, I think the notes were really very good, and they were like they didn't like they covered all the previous year questions very surely, and obviously they relied mostly on concepts.
Mm-hmm.
So I think the notes were really good, but otherwise, after obviously giving many TNDs and GTs, we have to add many more things. We can't just rely on basic notes
Mm-hmm.
always. So I think with notes and doing our work of our own, I think it was a complete thing.
Okay. So, which classes did you liked most, Pranjal?
I think Thamim sir's medicine was the best overall. That was my favorite, especially the way sir has taught cardiology. It's really like he has made it really very easy for us to understand those concepts. Other than that, ma'am, I think pediatrics also sir did very good. Ma'am, what you taught in visual access and everything, I was always confused about that. So you cleared that part very well about darkroom procedures and so, ma'am, I think it was overall a good experience with that.
Okay. So, you continued with the testing discussion series also, Pranjal.
Yes,
So,
ma'am.
how was it useful? Like, you have already done all the subjects, and how is it useful to do the TNT?
Ma'am, TND is like a application of what we have read. So TND I used to attend, I think in the later half of my final year and in the initial few years of my internship, a few months of my internship.
Okay.
So during that time, it's like we are not that heavily prepared that we can give a GT and score very good.
Mm-hmm.
So through TNDs, we gradually improve ourselves and see our identify our commonly done mistakes, and also we see what others are also doing in that. And through discussion also maybe related to the topic, we get to know some other similar questions also, which may not be there in the notes or which may be there in the notes, but we have forgotten about it.
Yes.
So
So to update the your
yes,
notes
ma'am.
also, yeah.
Yes, ma'am.
Okay. And you were doing your preparation side by side. You were having your postings also. So how did you manage both the things at the same time?
Ma'am, it's a
It's a
difficult
most,
question.
difficult question.
Yes, ma'am. It's a difficult question, especially like I was in MBBS in Safdarjung, so we have very hectic
Yeah.
internships duties. But like in that only we have to manage somehow. Uh,
So
like
that
on
is why everybody is interested in knowing that how did you manage? This is the most frequently asked question.
Yes, ma'am. I think in very heavy duties, like we have labor room duties, which are very heavy, 10 hours, 14-hour duties. during those times I
Labor room
was
पे तो boys are usually relieved ना, girls have to do more work.
मैं वर्क तो कम ऐसा नहीं, वर्क नहीं करना होता, बट अगर वहां पे 14 आवर्स है तो 14 आवर्स तो रहना है।
रहना होता है, but usually boys escape the things ना, girls are usually caught.
हाँ, यस, यस।
Orthopedics पे boys are caught and I think वो
Ma'am,
भी
I don't think it's there in Safdarjung. Like boys
अच्छा
also have
not
to do a lot of duties. There is a slight difference, but I think we have to also do a lot. And ma'am, ऐसा नहीं कि like if we are free, then we are going to sit and study there. That is not possible.
that's a
हाँ,
crowded place and you
हाँ,
obviously
that
cannot study. So what do you used to do then in that period?
ma'am,
How did you use it?
ma'am, like if I have heavy duty, so like I'm not able to study that much during those times. So that was actually my favorite time for studying for any TND, because like let's suppose if there is a TND coming up of any subject, let's suppose opthal only next week, then
Mhm.
I have every day at least spare of 3 to 4 hours. So
Mhm.
that week I will prepare whatever 3 4 hours I'm getting during those duties for opthal only, and maybe alternate day opthal, like once if I do, I will do it properly. So that hectic duty will also last for only 1 to 2 weeks only. Like 2 weeks after that, there will be a time when I will come for lighter duties also. So that time I will focus on major subjects and everything. So during hectic duties I preferred doing minor subjects more, so that I use that time.
All right. So did you also prepare your 20th notebook or you utilize the one shot program for the last minute revision?
No, ma'am. I made a personal 20th notebook regarding everything I
Mm.
needed to study in my last few days.
So how much important it is to make the 20th notebook?
I think it's actually quite important to make. Although I had made a 20th notebook mainly of the questions and topics. Like I just used to write a few lines or something about maybe which I used make commonly mistakes or something if it's not there in my notes. I just used to add in my 20th notebook.
Mhm.
This time I think it helped me more in INI because many questions came from my 20th notebook, but
Mhm.
in NEET, I didn't feel it was much helpful. But I think in INI, many questions, I think that last 20th notebook was quite helpful to me.
All right. So you used to give the grand test too, Pranjal?
Yes, ma'am, regularly.
How much important it is to regularly attend a grand test and how did you like the grand test?
Ma'am, grand tests are, I think, the most important thing in the preparation. Because initially, when we give a grand test, like I have asked it to my friends also, they also say the same thing. The most important thing is sitting tolerance, I think. Like just sitting for the exam for 3 and 3.5 hours, that is most important. In the like first few GTs I gave, even I was not able to sit for the GT the whole time.
Hmm.
I
Hmm.
just used to give GT whatever I get, and I used to just like move away and okay, it's done, whatever it is. But
Yeah.
gradually, when we start giving, then we develop that sitting tolerance also. We have to sit for 3 to 3.5 hours with patience and give that exam. So I think that is the first step for giving GT, and marks gradually improve after if you start reassessing the things and your mistakes, and you like the more revisions you do, the more you will like find those points which you are maybe didn't find last time.
Okay. So did you gave this NEET PG 2024 too?
Yes, ma'am. I gave.
And your rank was?
Mine was 591 in that.
So, Pranjal, what was that most important difference in the preparation of the two papers that your rank suddenly from 591 has dropped to double digit 21? Amazing. What is that one major difference?
Ma'am, I think it's a lot on it. A lot depends on the one's like presence of mind during the exam. In NEET, like in May, INI also I scored 85 rank. So in NEET, what happened, I personally felt was that it was, I don't know, the paper was very difficult or something happened, but
So you
my
were
presence of,
stressed out at that
yes,
time?
no, I was stressed out a bit that time. So I
Mhm.
did very, very silly mistakes also. So my rank fluctuated a bit towards the backer side. So I thought maybe let's try once more in the INI November. So uh,
And you proved yourself.
yes, sorry.
Right. So, Pranjal, any other piece of advice that you would like to give from your journey? You have given now three papers, learned a lot.
Ma'am, the most important piece of advice which I feel is that the most of the paper comes from basic notes and what you have read only.
Hmm.
So it's not that the paper is coming from somewhere outside. If there is a question which is very hard, it is hard for almost 99.99% of the students.
Hmm.
So one should not focus more on those topics and those things. And PYQs are very important in this INI November. Also, many questions were repeated directly from INI May. Just a slight with a slight twist. Many questions were directly repeated. I
I think
think PYQ.
maybe that chemical injury question
Ah, yes, ma'am.
was very
And
clear.
ma'am, yes, ma'am. And in those questions, like in the chemical injury question, there is always a bias involved with the examiner bias. If
Yes.
examiner says the first answer would be taking history, then that's the answer. If he says directly irrigation is the answer, then
But
that's the
what did
answer.
you mark, Pranjal, there?
Ma'am, I personally marked the irrigation one because I felt if someone has come with a chemical injury and already
Yes,
it's
exactly. So there is no point of taking history there.
yes, ma'am.
With your access, I want to tell this to all the students out. Please don't take it as a history because we cannot question whatever is actually given by the examiner himself. If he's
Yes, ma'am.
already confirming that it's a chemical injury, we
Yes,
don't
ma'am.
have to go back and confirm
Yes,
that
ma'am.
it's a chemical injury or
Uh,
not. It is something like this that if the patient is coming asthmatic or asphyxia, and we say that without before doing CPR, I will have to ask the history from the
uh,
patient. Are you
yes, ma'am.
actually suffering or
Yes, ma'am.
not?
Exactly.
So, इसीलिए you don't have to do history and examination. We have to give treatment. Irrigation
Yes,
is
ma'am.
the right choice. You have marked it right, Pranjal.
Yes, ma'am.
Right. So, Pranjal, heartiest congratulations. If you want to address any of the faculties, any of the classes that you liked most, you are most welcome.
Ma'am, I found Ashwini sir's anatomy really good, and Thamim sir's medicine I have already told. And your darkroom procedure and everything, retina also you taught that was really nice. Praveen sir, he taught pathology, it was really good. And pharmacology, when I actually did those videos, Bharat sir was there, so he cleared he has taught pharmacology very nicely.
Hmm.
So that also I think is good. That's all mostly.
Right. So awesome rank and awesome advice from you. Heartiest congratulations from whole of the team DBMCI Pranjal. And we wish you all the very best for your future endeavors too.
Thank you, man. Thanks a lot.
All the best.
Thank you.